quick note before today's show. We have transformed our entire platform to respond to the current crisis and increased our production of both podcast episodes and blogs, but we cannot do so without your support. Please consider making a donation or contributing as a volunteer to support our active engagement at this critical time.
If we are complacent and don't do really aggressive containment and mitigation, the number could go way up, many millions.
To be isolating patients, emphasizing social distancing.
Wuhan, China confirmed the coronavirus outbreak is now a pandemic.
That COVID-19 can be characterized as a pandemic.
In Italy, one of the worst affected countries, the pace
and business supply chains are being disrupted around the globe. This combination of people being unable to work, businesses being unable to
It's confirmed the coronavirus outbreak is now a pandemic.
Hello, Insight Myanmar listeners. My name is Mary, and I'll be your guest host for this episode on COVID-19 in Myanmar and what is being done to try to slow the spread. I am a Canadian international development worker and lived in Malamyane, the largest city in Myanmar's southeastern region, for 2.5 years. Now based in Canada, my heart broke in February with news of the coup, and I started looking for ways to support the pro-democracy movement. In addition to assisting my own colleagues in country and along the Thai border, I joined the Global Movement for Myanmar Democracy, a group led by the youth of the Myanmar diaspora. This group works on advocacy at a global level, fundraising and movement building for support to CDM and humanitarian response. In today's episode, we look at the context and politics surrounding the current wave of COVID-19 in Myanmar, as well as the personal, lived experience of surviving the Delta variant in Yangon. Our first guest, Alyson.
So Delta has been shown by the CDC, is a lot more transmissible.
A second-year med student shares about the impact of this particular wave in Myanmar and the strain on the healthcare system. Our second guest, Michaela.
A friend saying, hey, this person tested positive, and then after that sort of
gives us an intimate look at the fear and pain of treating COVID-19 without any external support. Our final guest is Sandra.
When the coup happened, through prior experience I've had in Myanmar,
a med student and co-founder of GM4MD, who will talk about some of the responses to the crisis and political actions we can take to support healthcare workers and the pro-democracy movement. So please sit back and enjoy these interviews.
Whatever karma that is good you have done, this will protect you.
It's certainly a teaching for the world of interconnectedness. We will realize the nature of interbeing and interconnectedness. It's really an opportunity to come back to our own intentions, to our own heart, to our own body and mind in this moment. Remember peace in the face of suffering.
Change, for sure, to the better.
We can perhaps see an opportunity in this situation. Their meditation practice, it's a beautiful gift to the world.
People can learn how to help each other and how to love. Mutual support in the time of hardship. They learned how to support each other unconditionally. People can become closer to each other, seeing new horizons of life.
I do see some positive aspects of this corona crisis in the world. We're all sitting in one boat. We see that, in a sense, that brings people also closer together. That we are all looking out for each other. People getting closer together and watching out for each other. We have more time for our families, for the community, and time to meditate.
Hi. Could you just start off by introducing yourself to the listeners?
So my name is Alyson. I am currently a second-year medical student in Texas, and I am a Burmese Chinese American citizen.
Excellent. And in your opinion, from your perspective, what is happening in Myanmar right now with COVID-19?
So basically what we're seeing currently in Myanmar is the result of a complete healthcare collapse because the military has been targeting healthcare workers for many months, and the COVID infrastructure has basically been obliterated. So no tracking, very little testing. The COVID facilities are just not up to par with what is needed right now. And unfortunately, the Delta variant has really taken a hold on the country, and that's resulted in many unnecessary hospitalizations and deaths, and just many more tragedies that the people of Myanmar don't need right now.
So going into more detail, what had been happening in Myanmar to respond to COVID-19 before the coup? So in the first and second waves, what kinds of measures did we see?
Yeah, so we definitely saw a lot more preventative measurements taken against COVID by the civilian government before the military coup. So you could see the stark difference in how much more organized, clean, and pristine the COVID quarantine facilities were. There was much more accurate tracking as well as testing. And obviously there were less opportunities to spread the virus because there were no arbitrary arrests, or there are no mass protests against this military government. So there was less opportunities for the virus to spread in that way. But unfortunately, it's definitely spiraled in the past couple months
Yeah, and what is it about Delta that is like making it unique from other variants?
So Delta is, as been shown by the CDC, is a lot more transmissible, and it actually it has been shown that there might be some sort of evasion techniques it can have against even vaccines. So, I know some people in Myanmar who got a vaccine for COVID and they still got infected with Delta. So it's definitely just much more transmissible, and there has been some evidence to show that it might be more deadly, as well as the fact that it could evade some vaccine defenses. So the possibility of breakthrough infections are definitely much more probable than the past couple variants that we've seen.
Right. And what part of the population is it affecting? Is it mostly much older people, or is it also younger people this time?
Mm-hmm. So it's basically everybody. Younger population in the past has definitely had a bit of a leg up in terms of being protected from severe symptoms of Delta. But, even looking at America, a lot of the hospitalizations happening right now are young people. So Delta is definitely much more deadly to everybody in general, but we are seeing a lot more young people get infected and with severe infections as well. And that's very concerning.
Right. And I guess we don't know for sure what's happening in the prisons in Myanmar, but what would you guess is taking place with COVID-19?
I definitely think the prisons are majorly underreporting the numbers of COVID right now. We have no social distancing in prisons, no masks. You're living in very, very terrible conditions. And it's honestly inhumane. And I'm guessing that, and people aren't even getting the medical care they need in the prisons. If they're showing symptoms, the military definitely will not hospitalize you or give you the treatment you need unless it's absolutely probably too late for you. So what I'm guessing is that prisons are just becoming a huge super spreader hub for COVID. And it's definitely very tragic to see.
Right. I've heard from people in Myanmar that a lot of people with these serious cases are trying to avoid the hospitals. So what options do people have if they develop these respiratory issues and they're trying to stay at home? Like what are they doing? What works?
I think that something that I've heard that people have been using in, Myanmar and also just the Southeast Asian region is an antiparasitic called ivermectin, which is very interesting. They're currently doing some studies on that, and ivermectin is definitely a bit more accessible and cheaper. For a normal person, to be honest, there's not a lot you can do, which is extremely tragic and just very sad because it's something so preventable. If you catch it early, if you start showing symptoms early and get the treatment you need, your chances of survival are a lot better. But for the people in Myanmar, just a lot of the options for treatment have been hindered by the lack of resources because of the military government. It's very tragic.
Mm-hmm. And people have been using devices called oxygen concentrators. So maybe you can just tell like the listeners that, because I wasn't sure what that was either. So maybe you can just describe what that is.
Yeah, of course. So basically, the main thing that COVID really affects is your lungs. So a lot of people will have respiratory symptoms along with COVID, and a lot of the time it can get very severe. So they aren't getting enough oxygen in their body to supply their tissues needed for normal functioning. So what oxygen concentrators do is basically kind of supply that oxygen for you because your lungs are not able to take enough oxygen from the air. So oxygen concentrators are very helpful, and they are extremely effective in helping people breathe whenever they can't because of COVID.
So would you say it's kind of like the at-home version of a like not a ventilator? I know that those are very intensive and intrusive, but it's kind of like a take-home version of that.
I don't know if I would. I don't know if I would say that necessarily. Okay. But I think that it will help you breathe without needing a ventilator, if that makes sense. So I think it's like, I wouldn't say it's a take home, but I would say it's definitely like a level up from it in a good way.
Yeah. Okay. I see. Yeah. I wanted to talk about it because I know they've been very popular items for people, and it's something that here in North America, we haven't had to think about how to, if we got to that level of ill, we would go to the hospital. But
yes, in the hospital, usually will supply you with that oxygen. So it is something used in the hospital for, severe, moderate to mildly severe, but not extremely severe. Whenever you have an extremely severe case, usually they will put you in a ventilator. But for most cases, we have something called an O2 oximetry measurement. So we measure your O2 saturation, and that number should usually be in the 90s. Ideally, it'd be above 95. So whenever your O2 starts dropping, that's whenever they start supplying the oxygen through the oxygen concentrator.
Yeah, these devices have also sold out in Myanmar because people are becoming their own nurses and doctors and trying to take care of their families and neighbors. Right?
Yes, yeah. That is correct. And, I don't think that the people of Myanmar and the ordinary civilians should be doing that. That is something that in America, usually trained medical professionals will do. So it's just very sad to see that people have just had to fend for themselves in this case.
Absolutely. Yeah, it makes you feel very fortunate to have all the infrastructure that we've got set up and the support is happening with vaccinations in Myanmar. Is there any hope for a mass vaccination campaign? Because I know that other countries in the area have been actually quite successful in their vaccination campaigns. So what is the hope in Myanmar?
Yeah, of course, I can talk about that. So just a little bit of background, Myanmar before the military coup was supposed to have one of the best vaccination plans. in the Southeast Asian region. Like, they were already starting to vaccinate healthcare workers. They had a whole system where they basically were saying you can't skip the line. So, healthcare workers were getting vaccinated first, and the elderly, and then on to just the basic necessity and urgency for the need to get vaccinated. Unfortunately, whenever the military coup happened, that vaccination plan kind of was thrown out the window, and the military kind of sequestered vaccines for themselves, which is unfortunate. But I've heard reports of other countries trying to contribute vaccines to Myanmar. I know that there's certain vaccines that people are kind of starting to have to buy by themselves. I'm not exactly sure how that works, and it's not really exactly a verified news source, but just from rumors of word of mouth that you can buy certain vaccines like Sinopharm and things like that. But to be honest, I am not completely sure about a mass vaccination campaign right now, considering the tension between the military, the people, and also the NUG trying to also be a part of that vaccination plan. It's a very complicated execution, to be honest. And there's a lot of moving parts that are involved with that.
Yeah. And what are the risks to having this country like Myanmar that's so almost impossible to cooperate with, like internationally, with vaccinations? What is the risk of having a population with such a high rate of incidence, I guess, of COVID?
Mm-hmm. So the biggest risk that I see letting Myanmar go unvaccinated completely is another variant coming out that's even worse than Delta, and that can evade even more treatments, as well as our current Pfizer, Moderna, all the other vaccines that are happening right now. And there's still movement in and out of the country with people fleeing, which obviously no one can blame them for doing that. And just with movement out of the country, it is very possible that another variant worse than Delta could spread. So the whole world needs to pay attention to what's going on and try to get the people in Myanmar vaccinated, because we want to end this pandemic. And with Delta, we've kind of taken a step back, but letting a country like Myanmar go unvaccinated there's definitely a huge risk for causing another variant to spread among Southeast Asia first, and then the rest of the entire world.
Yeah, and we'll just highlight again, most listeners know this, but interaction between Myanmar and China is very high. Lots of business links there. There's border crossings into India currently out of Chin State. So it borders with like a lot of the world's population. What kind of campaign or activities have Myanmar American medical students been carrying out in solidarity with the healthcare workers in Myanmar and students, not only healthcare workers in Myanmar, but also students, right?
Mm-hmm. Yeah. So back in April, we actually coordinated what we called a white coat strike. So basically, healthcare professionals in general, not just medical students, but all healthcare professionals were asked to wear their white coat, take a picture with the 3-finger salute, and hashtag it white coat strike. And maybe just talk a little bit about their experience in healthcare, or just spreading awareness about what's currently going on in Myanmar with healthcare workers being under attack. And I am so happy to say that campaign was so successful. There was a lot more participation than I thought there was going to be, to be honest. But we had like over 1,000 hashtags on Facebook. There were a lot of hashtags on Twitter. It was definitely spreading among all social media platforms. So that was wonderful. And that was one of the biggest things we did to spread awareness. Other than that, there have been donation campaigns for oxygen tanks and just to help healthcare workers in general gain medical supplies that they so desperately needed, and they still do desperately need at the moment.
And why do you think these doctors and nurses continue to risk their lives to try to help people? Why are they taking that gigantic risk?
I think that goes back to just the concept of healthcare in general, and what, as a medical student, what I was taught at basically the first day one, which is the concept of do no harm, and the Hippocratic Oath, which is to just, help everybody. As a medical professional, you have a responsibility to maintain the health of your patients no matter what. And I think that despite the risks, these healthcare workers in Myanmar are willing to risk their lives because they know that the civilians in Myanmar they need to stay alive, and there needs to be some sort of resolution to the coup. And for that to happen, there also needs to be civilians that are willing to do that. I think it's definitely the passion and the personal responsibility we all feel to treat all the sick and just every patient in general, because, as a medical student, day one of medical school, they really hammered in to our heads that our lives are being dedicated to this cause to maintain the health of our patients and the world in general. So I think that doctors and nurses in Myanmar, just like doctors and nurses everywhere else in the world, they're just passionate about maintaining the health of their patients to better promote just health of the country in general. So I think it's definitely just a personal responsibility and just a passion for their jobs, which is extremely admirable.
Wow. And do you have family in Myanmar?
Yes, I do.
So I'm just wondering, did you have a lot of people reaching out to you, or do you still have a lot of people reaching out to you because you are the medical student and they're asking you what they should do? Have you experienced this kind of, and how are you coping with that?
So my parents are actually doctors.
Okay.
So my parents are doctors, so my family reaches out to them first before me. So I haven't had to deal with that, but I think that it has definitely affected me because I do see a lot of my family members getting infected with this virus, and it's extremely scary. Like I said, one of my family members was vaccinated and she still got infected, and I wouldn't call any of their courses of sickness a mild or just like a common cold. It was definitely more moderate, and it's very scary because one of them was around 30 years old, which is, you would think that wouldn't cause anything serious, but he almost had to be on oxygen. It was extremely scary. And I think that, to me, it's definitely influenced my outlook on the COVID situation in the U.S. Personally, my feelings on it are just that I don't understand a lot of the discourse that's going on around COVID in the United States, because I feel like a lot of people haven't seen the true effects that Delta can have on just your mental health and just emotionally and even physically. Seeing your family member get sick and knowing that there's not a lot that you can do for them because you're on the other side of the world it's a new feeling of helpless, and it's really sad, to be honest. And I really hope that, the United States doesn't ever come to that stage, because it's really hard to deal with.
Do any of your friends and family in Myanmar ever ask you what is happening in the US? Are they ever curious why there's people that don't want to get vaccines?
To be honest, no, probably because they're occupied with their own situation, which is much, much worse. And I definitely don't blame them, but I don't understand personally. And I think that just has a lot to do with perspective. Just like I said, a lot of the people in the United States will never experience seeing their family members suffer because of something so preventable. And in a way, I kind of pity them because they're never going to know the feeling of just that feeling of empathy and just I feel like it's almost in a way kind of love, because you kind of realize how much you really love the people around you, to the point where you just feel extremely sad whenever you see that they're suffering like this. And it's just, it's a really, I think it's a lot of emotions. And I personally have felt like this, and I think a lot of my friends who are Burmese or from the diaspora have also felt like this. And we just see the situation in the U.S. so differently than I think a lot of people do.
Yeah, I've seen on Twitter a lot of people who call both countries home, using actually the same word you just used, was pity, to feel this pity that there's this lack of community care and this lack of wanting to take care of each other. Yeah, that's interesting. Yeah. Back to Myanmar, what are the long-term implications of like such a high infection rate going down even like years to come? Like what are going to be the after effects of so many people getting COVID?
So I think that that's divided into twofold, right? So to be honest, we don't even know as a world what the long-term effects of getting a COVID infection are. So basically, we're going to see, what I'm thinking at this point, and this is an expert opinion, just something that I've observed, is that people who have had a lot of severe lung issues with their COVID infection are going to see a lot of health problems with their lungs to come. Like you already see, there's x-rays of people infected with the Delta variant, and you can see that their lungs show a lot of fibrotic tissue, which is not a good thing. That basically means that your tissue is not taking in as much oxygen as it needs to, and that your O2 or your oxygen capacity in your lungs is going to be severely affected, which is going to affect your day-to-day life. On the other hand, you also see that there's a thing called long COVID, which is basically people experiencing these really unknown and kind of I don't want to say weird, but like just symptoms that they weren't expecting to feel. A lot of it has to do with fatigue, just tiredness after that. So I can see a lot of that happening to the people of Myanmar. And I think the other aspect of it that will affect a lot of people, like probably nearly the entire country, is just the emotional aspect. You know, seeing a loved one die or seeing a loved one suffer like that, and seeing multiple loved ones suffer like that, that just has a lot of psychological implications that will affect the mental health of a lot of people in the years to come. And I think that we're going to definitely see those effects start to manifest itself in a couple of years from now, which is really, really tragic.
So really what Myanmar needs to recover now is really strong health infrastructure, both in caring for these like respiratory issues, all those weird issues. They are weird issues. I've also heard of people having like the worst yeast infections of their whole entire lives related to COVID. Like it's strange things. As well as the mental health infrastructure on a mass scale. And Myanmar doesn't have it right now.
No, they don't.
Yeah.
And I really, really wish they did.
Yeah. So what would you say going forward in an ideal situation, in a stable situation, what would Myanmar need to do to respond to what has happened already?
So I think firstly, there should be a mass vaccination campaign, and it should be accessible, very accessible. Pretty much, I think it should be free, to be honest. So just a mass vaccination campaign. And I think that along with that, there might be some misinformation going around. I know in the United States there is. So just also alongside a vaccination campaign, just a misinformation debunking campaign for individuals who may have some misconceptions or just may not understand the implications of getting vaccinated versus not getting vaccinated. Although I feel like the response to a mass vaccination campaign would be a lot better in Myanmar than the United States. So I'm not sure how much we would actually need that. I think that, you can see the current issues going on. We need hospitals. We need a lot of hospital bed capacity. We need ICU capacity. We need doctors and nurses to not be completely scared of getting arrested or killed because they're doing their passion and their job to care for people. And we also, I think that there should be more funding in an ideal situation put into getting adequate mental health resources for individuals going through loss and going through just the trauma of seeing family members get COVID. So I think those are four things that are definitely very pertinent to me and important that in an ideal situation.
Right. And are you currently involved in any other advocacy work other than the white coat strike?
So I have been involved with medical advocacy and the global movement for Myanmar democracy. We're not currently as active right now just because of certain situations. There have been, and also the COVID situation is really not the best right now. So I think that we've been trying to get information about COVID out to the people of Myanmar to better help them in the fight. But yeah, that's mainly the biggest thing that I've been involved with with medical advocacy is just with Global Movement for Myanmar Democracy, doing the white coat strike, and also just making infographics and spreading the word about what has happened to healthcare workers in Myanmar.
Great. In your advocacy work, have you come across or learned about like what kind of role the international community can play in helping to respond to this COVID crisis in Myanmar?
Yeah, I think that, first of all, there's definitely money needed to be put into donating for COVID supplies and just things that will help combat COVID in the civilian population, because the military is still very much actively ignoring that situation. So I think money is, first of all, one of the most important things. But, if you can't monetarily donate, I think awareness is a huge thing. Just spreading the word about what is going on and like the state of the COVID situation in Myanmar is so important. And that doesn't have to be through social media. That can be through word of mouth to family members or to friends about what's going on. And I think thirdly, what the international community can do is also get vaccinated, because I think that that's just a little part that you can play in helping the situation, because, I see all these vaccines in the US just not being put to use. And it's really painful to see that, because I know that a lot of people, not even just in Myanmar, but in like other countries, could really use that vaccine. So if you have vaccines available to you, I think that is getting vaccinated is one of the most important things you can do, because I think it could be a sign of solidarity. And, people might not agree with me on that, but I personally think that's like a really, a symbol of solidarity to the people of Myanmar, because you're doing your part to prevent further infection. And, a lot of the new strains that have come up have been because of just one person, and they mutated the virus. Their immune system somehow mutated the virus, and that spread. So you do not want to be the next spreader of another variant of COVID. So getting vaccinated is one of your best bets to not do that and to help the people of Myanmar.
Yeah, that's a nice way to think of it. And that's what we've been saying all along, right? Is those of us who can get vaccinated need to, because there are people who can't. And right now, the people of Myanmar can't because they don't have access to it.
Mm-hmm.
So you're right. Yeah.
Yes.
A sign of solidarity. Great. Alyson, was there anything else you wanted to share on the podcast?
Yeah, of course. I think that, the activists on the ground have been doing so much work to not only just to spread information about what's going on in Myanmar. Like, I feel like I couldn't have gotten a lot of the information I have or been as updated on this situation if I wasn't following certain activist accounts on social media. So I think that a lot of the credit to just being able to make some of these movements possible, especially the white coat strike, goes to the social media activists who continuously risk their lives to inform the rest of the world about what's going on. And I think that we really couldn't do it without them. And I think that a lot of the credit should go to the people on the ground and the people, especially the ethnic minorities activists who are just informing the rest of the world what's going on in the rural states and everything like that. I really, really appreciate them so much. And I know that they are risking so much just to put it out there. So I want to give a huge shout out to them.
Yeah, definitely. Well, I think unless you've got more to share, we're going to wrap it up. Does that sound okay?
Yes. Thank you.
Great. Alyson,
okay. Thank you so much for having me.
Of course. Thank you so much for sharing some of your medical expertise with us on the Delta variant and what's happening in Myanmar. Thanks for talking a bit about your personal experience with your family there. It's been very, very insightful. And I hope you've convinced some vaccine hesitant people maybe to go and do it in solidarity.
Yeah. Thank you so much for having me.
Mr. General-in-Chief, I don't know where or how you are in these dreadful days of bloodshed, but I hope you can stop for a while to put down your guard and defenses and listen to a monk's words of reason. Mr. General, the power is now in your hands. You grabbed it as one picks a beautiful flower in bloom. Our land in all its grace has fallen under your grasp, but withers away, perishes in your clenched fist. You see, in order to stay strong and healthy, this kind of flower needs to be kept alive and free from all that's doing injustice and harm. This flower has shown the world again and again the need for their roots to stay firm in Myanmar's soil in order to thrive and grow many, fulfilling a whole garden of flowers. Instead, we see soldiers trampling all that's precious. No rules except the rules you've made them believe. It's wrong, Mr. General. Have you no eyes to see the damage? The beautiful garden in all its charming diversity has been sacrificed for power, imprisoned with violence by a martial dog barking day and night. Listen to me. The flowers are now closing their petals, slowly adjusting. The sun is not there anymore, has become hidden behind clouds of mistrust and destruction. You're trying to convince that our power is your power, to rule, to own, and to control. I'm sorry, Mr. General, but we've already made our choices. Whom to trust, what future to believe in, and all voices were assured to count. The next 4 years we were convinced of the gift, of less violence, of more justice and freedom. A new web of power was allowed to assemble from the people, with the people, for the people, and had become the sprouting roots of our nation. Now you and your soldiers took that away, denying us the trust, as so many generals have done before you, forcing us once again to live with guns in our backs. The flowers are waiting, Mr. General, for you to come to your senses, patiently but not all that obediently, for the wind of change to blow fresh once more. The walls and fences you've put around us might keep the wind out, but not for long. Nature always finds us a way to freedom and will raise us in bloom once again. And deeply rooted inside our hearts, in fertile, fearless soil, new seeds of resistance has already sprouted, a secret garden you will never be able to control. We ask you, all generals of old, uncover your minds, release your darkness and its heavy shadow, step out of the way, and so become part of us, the people, a people without the violence and the killings, a people concerned for the happiness and benefit of all, this would be in accordance with the Dhamma. When like ba, yidu yahan yidadi. Bojo muji kamya be yao nele, jang kanta lo ma ba leza. Jong matibu na jinsia kaung bi thuiso ne dilo ne yet dwi ma. Though a kite itan the kula, kamya da nai mesura goro, nyole mi bare. Kamya yet lonjo yet that way, pian yo think the bobo. Now, Beku de yet, Sinjin don de arego, na swin like ba. Bojo muji kamya. Lashi anaga kamya let him aba. Kamyaga anago lu you like no. A swan gong pointed ban la la de buengo, who you like the lobe. Jetty Sheila at Jodo and Nanga Hale, Kamya Latizo Alma, would draw Casa Kea Babi. Though, Chit had a Latirema, you larabo, Jessie the abo. Kamya Tibare, a song go Buena Nine boat, deep bandre, Lulula Shentan Boya Quenga, Machine Chips or Agole. Tugo Pinate Choche Nira Jaga, Baha, Kabajigo, Jane Jata Kelly. Mam ye jirego, Nana Shanshan and yet dressable, cat latry, we sasa shentan G2 9 bo. Now we and alone, Wanga swim point 9 bobo. Tabe mele, a poem of Chanine, di yadre alongo, Sitadrega, Ninche Pesida go by Jodo Mien Drekare. Ubrile nati, through Yonjikane Ubre Malo Bolly. Daria Mabare, Bojo Mujikamya. A night high on the Miena Melone, Kamyama, Mashike Leodala. Do Guepia Murin at Yenanere, Chesia Uyen Liha, Anna Adra Channing Kanlayare, attend Adamat Town Dwen Kanyare. Dima not hounja, so be Neonyaba how needed sequeja, Yuku Kamara, Bandriha, Punchago Yote, the Pie Jenda Yala Ke. Thuria Nemela Matwatobu, Dandiana and Natayon de Mary now Bongo and Elie. Kamyaga Jodugo Sion Dane Dwene, Naru Anaga me Anade. Ocho po by Sambo, now think by Poyobe. One ever a bojo mujikamya. Tabeme, Jodo Yuche like Babi, Budugo Yamle, Penaga ha say chayadale, a thundry alo hale ye drapo a dimpini jabo. Lame lin a drain, a jampa mure yone lame, Bobi diam yada lame, Bobi lula lame lo Jojo Yonji kebare. Anna Goya at the ha, Bidu Jama, Bidu net to Bidu Rejama, Chesa Quayani heavy. Now be Jodo Nanga, Drekaza Yeta Mele Pie. Kuro Kamyaga Pepsi like Bibo, Jodo Yonji Mugule, Piesi Kere. Kamya Yembojo Jiri Loka the Lobabe, now Joma Chain Kayare, the Nat Dalan at Jodogo, the Pan, that session Zebiane. Bojo Muji, Bandri has Saune Jabare, Kamya Tinya Yala Bole. Say shit, they can't be a ball. Lowa you Jojo Nero be home levia. Now be a less or a lenu to Dela Mago your ball. Narugo win and tire and Nayan the Dainreha, Lemuela on Gasi Gasi Nine. Tower out of a home levia. Lula Mugo, a mere and sharp way down at the power de Aga Jodogo, the pump when lands the Lame. Ye see Oza being a Jaudia Kimere, Jodo and Alonda, Yetirema, Mietue Biro, Kanai music thickly drille, Lulum Pauala be, Kamya Taintolo Yamama hold it, Liu what lapare, Uyenly to whom we poala lame. Kamyane, a Yembo Jimia Along, Jodo down so bare. Kamyaro say a dwedre, you are point like ba. Kamyaro a mount do ne, a ye sorego, qua chalaiba. Yon twalaiba. Ngaro Pidu Rega Pidu Unine, Shentan Laiba. Janda Yesa, Tapyamu Machine Pidu U, Pyoshin Pue Alongo, down Pidu U Pit, a Thashan Nitai Jendi, Diatamane and ye, a Thashan Jim Pibele Ba.
We've invited this next guest onto the podcast to share with us her own personal experience of living and nursing herself through COVID-19 in Myanmar in these last few weeks. We are going to withhold her name and as much as we can about her identity just for her own security. But we're going to ask her some very personal questions about what living through COVID-19 has been like in Myanmar. So welcome to this episode about COVID-19 in Myanmar.
Yeah, so thank you so much for having me on. So I was sick within the last month in July, and I got it right before I feel like the boom of everyone having it in Myanmar got COVID. I got it a few days before that, and I basically got the call from a friend saying, hey, this person tested positive. And then after that, sort of started contacting all of my friends, treating it like I'd given an illness to a lot of people and just really worried about that whole impact that I could have had on the community. So I had to contact, my colleagues, my friends, and everyone, and just sort of prepare. So it was sort of a panic. I remember going right to the pharmacy to just pack up on whatever I thought that I would need, vitamins, paracetamol, all the things that sort of people were recommending. But at that time, I didn't really know what you were supposed to buy. I think we've gone through this COVID experience in Myanmar very differently than the rest of the world, where everyone has gone through this massive wave in the West, but people here haven't really had this, explosion of cases and deaths in Myanmar yet. So this has been a very traumatic wave where I feel like everyone was learning what to do. And also it's very different than the past variants. So we're all learning really fast and we have very little references and support. We have to figure it out on our own. So I remember the day that I found out I had it, I went to the pharmacy, went home, and we just prepared. We didn't leave the house. We locked the door and we just sort of prepared for the next 14 days. So I remember that, when I went to the pharmacy as well, before I locked up my doors, I went to the market, just bought everything that wouldn't perish for a week. And then just started, thinking about, what could the next 2 weeks entail for us. So it was a very scary experience, I think, for myself and for others. However, I feel very privileged that I got it right before many other people knew they had gotten it. So I was able to, still access supplies in the pharmacies. I was still able to ask friends who are healthy to go shopping for me and just assist. But I think if I had gotten sick a week later, I would have not been that lucky, because that's when really things started to shut down. I think around the time that I got it, they had just started to say, okay, like restaurants are going to start to close. And so we thought we had it. We didn't know if we had it, but we knew we weren't feeling right. And so I ordered a test from online. And so I was able to test at home. And then that's when we confirmed it. But luckily, everyone that I contacted didn't get COVID. Meaning all the people that I contacted, before when I think I got it, and over the weekend, I thought, oh my gosh, I gave it to all these people and I didn't. So I felt so lucky.
It's nice to know that you're not a super spreader.
No, exactly. It was probably the biggest relief of my life because, you feel like, some people, I think in the last waves, people would really withhold if they had it and like get really scared and they wouldn't tell anyone. But for this wave, I feel like people, wanted to know because, there's the danger of what it can do when there's no functioning health system is much greater risk than the previous waves. Like you couldn't really not tell people. And I remember when I actually did tell people, it's that kind of a panic, but I think a good panic among people like, oh my God, I need to start to prepare. So I think it was really lucky for that. But our experience with COVID was really traumatic. I think that people don't really talk a lot right now about, well, you do see it in social media, but it's like the trauma of the oxygen is one thing, but just the trauma of at what point do you do what? Like, what's the next step? Especially if you don't have an oximeter. So I remember I was really stressed. I started getting really bad anxiety throughout it. And I started to note take day by day what was going on. And then finally I felt calm down, noting our symptoms, noting what's happening, noting what medicine we're taking, noting how we feel.
You became your own nurse.
Yeah, exactly. Yeah. Because there's no one else to nurse. I mean, I was calling doctors abroad, getting their assistance, but I mean, they can only just make you mentally feel okay. They can't, help you. But I'm very thankful. So, I think like all the symptoms that they describe, I think most people, including myself, were experiencing them. Delta has quite a range. But it wasn't until day 10 that we started to feel okay. And I would say okay, but just a little bit functionable, or functioning. And, but I mean, to this day, we're still struggling with the aftermath of it, almost a month later. So I think people, really focused, of course, understandably on, people who are dying of oxygen, but also people who are recovering. There's this idea, they're okay now. But we don't know enough about what's happening in Myanmar to actually know how people really truly are, and what they're experiencing and what the trauma of this experience and what it's doing to our mental health. I think one thing that I noticed going through this experience is that there's a lot more effects on your mental health than is discussed. In addition to everything else that's happening in Myanmar, you have this really traumatic health experience on top of all that. We don't know the effects that's happening on our mental health and just the anxieties. And so I think that was my most memorable symptom.
Oh, thanks for sharing that. Let's dive a bit deeper into that, the trauma and the emotions. So let's say when you first got that call, that someone that you had contact with was positive, what kinds of feelings, what went through your mind? What were you picturing?
I think just the question you had mentioned, am I going to be a super spreader? Because I was already out at that time. And so what do? Just turn around and, go straight home. And so I think it was just that worry of like, oh my gosh, like what impact could I have had on the community? So I think that was my main, just fear. But then also, just like I had mentioned, what kind of COVID do I have? And then also, what is Delta? I mean, I think a month ago, no one really was talking about Delta a lot in Myanmar. And I think that it was just like, I really didn't prepare for this. You're preparing mentally for so many situations and scenarios. And we always knew COVID was coming. But it was just this idea of like, we've put this in the back of our mind for so long, and now we have to deal with it. And I just felt overwhelmed, we're going to add this onto everything now. Okay. Yeah, here we go. We have to just deal with it head on and get ready. And like I said, just feeling really lucky that I went into a pharmacy and there were supplies and that we could order oximeters when no one could a week later. So yeah. I would say, fear and just feeling overwhelmed.
Yeah, I think overwhelmed is the word of the moment for sure. So you have lived through a few COVID waves in Myanmar. And I just was wondering if you could talk a little bit about how this one is different for the people, because we have already talked about, we all know that it's different politically, and there's many factors that have made it different. But for the communities and the people, how is this one playing out differently?
I think that the biggest difference is that in the first wave, there was a lot of trust in the Ministry of Health and Sports, and in the government response. And there was a lot of, telling people, okay, let's trust that they're doing their best. And I think that there was just a lot more trust. And right now there's no trust. We don't know who to trust. And I think that lack of trust is probably the biggest difference, is that we feel very isolated and alone. And we have to deal with this on our own, and we have no support. And I think that that's the biggest difference. I mean, even by the second wave, even though people didn't want to follow restrictions, there was still this idea of like, well, they're probably doing their best for us. And they've been able to develop all these testing centers and all these systems that weren't there in just a few months. And now we see just a total unraveling of any system. And we see absolutely no response to how we are going to support people.
I think that's a great answer. I think you've really isolated what has changed for people. So we talked about that you were lucky to have access to doctors that you could contact, doctors living outside of Myanmar. But what types of information would you have access to within Myanmar? How are people learning anything about this variant that's coming through and how to deal with it?
Social media, for better or for worse. They're learning everything through social media. And I think there's some work being done on telecommunication services for doctors to communicate with patients. But even within that, this goes back to this trust issue where, some doctors who are supporting these services were arrested recently. So now there's this question of how do we get connected to doctors safely for patients and for the doctors? But I do think social media has been really great at sharing information, but sometimes that information, like certain antibiotics, being bought up in the pharmacy and panic buying, is some of the downfalls of the social media sharing. But then also, I think that, there's a lot of people and a lot of organizations really trying to support as best they can. And so you see a lot of updated translated materials coming up on social media. But all in all, I think that there's nothing in addition to social media. I mean, there's no other option, right? Maybe some people use radio. I mean, radio has really made a comeback in the last few months. But I think just in terms of, mass accessibility, it would be social media. Oh, and then also I think, support from other countries. Like, I think there's just kind of this solidarity element. So, Southeast Asia is experiencing this, not just Myanmar. So I do think, once information kind of comes out from Thailand, then that's shared within Myanmar because they might have the capacity, or they definitely have the capacity to be doing more research on what's happening. And so we're not getting any awareness of what variants we really have. We just know our symptoms align with Delta, but there, from my knowledge, has been no confirmation of that's what we have. We only follow what's happening in Thailand or following what's happening in Bangladesh or India to get an idea of like what's going on here, because there's no research being shared with the public and being publicized about what's actually happening. I mean, even right now, in terms of the numbers of cases, we don't really know the numbers. I mean, so I think regionally that's also helping share some information as well, because they're also experiencing this at the same time.
Yeah, it's another reminder of how interconnected the region is.
Exactly. Yeah.
And how important it is to work on issues and problems from a regional perspective.
Absolutely.
Great. We also talked about you feeling fortunate that you were out trying to get supplies earlier. What have you seen just in the last week or so? What is happening in your community and in communities around you?
So when you go into the pharmacy and you ask for the core medicines, the core vitamins, the core antibiotics that people are suggesting you buy, there's no availability of these medicines and vitamins at this time. And even if they are available, like, for example, vitamin D3, which is like the big vitamin everyone's suggesting everybody buy, if you want a bottle of that or a pack of that, it's 30,000 kyat, which is totally out of the budget for most people.
Whoa.
Yeah. And so that's a big barrier. I mean, there's some areas where they're selling medicine for, 3, 4, 5, 10 times the price. Even flu medicines that, paracetamol with some extra, ingredients in it, are being sold for 5,000 for 4 pills. And so it's just totally not accessible to a normal person. So you see a lot of the price increases, you see an unavailability of supplies. And yeah, I mean, even oximeters, without support from outside the country, we wouldn't be able to buy them anymore. You have to have those sent in, but you have to risk it getting confiscated because that's called like a controlled item now. Even sending face masks over the border is something that could be taken away from you, which is really, really shocking. So that's sort of what you see right now. I mean, I don't know if this has been discussed yet, but the egg price in the middle of July went up, one egg for 500 jet, which is something that would cost usually 150 or 200 jet. And so you see egg prices skyrocketing, or you can't buy them anywhere. And those are just, basic foods that people would buy every day. So you see this change in market and panic buying, but then also you can totally understand why people are panic buying. In the last few waves, you would be like, don't do that. But in this situation, you're on your own. You have to do what you have to do for your family. And so this idea of people buying oxygen, what other option do you have? If you want to go to a private hospital, you have to put a deposit down before they even look at you. And so there's really no options for people during this time. So, I mean, you even see in some of the convenience stores, they're selling body bags. So they're changing what they sell to help people during this time. It's very dark, but that's the reality of what people are dealing with, because they can't get the support that they need from any service. And if they do, it's risky. So yeah, we're seeing a lot of really scary stuff. And even pharmacies that are really accessible to the people. For example, today, this pharmacy was, had many people because people were trying to help their families, and it got shut down. So it's just very shocking. But the one thing to end on a positive note is that Myanmar is the most resilient country I've ever encountered. And so after all of this happened, you all of a sudden saw, a boom of online pharmacies and a boom of doctors, trying to support in any way that they could. So I think that there is a lot of positive reaction, and you see this in the social media community. So that's a really uplifting point.
Yeah, that I was going to ask about that as well, because I was still in Myanmar for the first wave, the first lockdown, and the response from Myanmar's civil society groups in order to make sure that people who weren't working had food and access to things they needed was pretty incredible. So there was a really big movement of just generosity and social well-being.
Absolutely.
Has that been possible in this wave? Because things have changed so much. So
I think you still do see it. When you see the white and the yellow flags being out, so people who need food, they put out a certain color flag. People who need just help because someone is dying or has died, they put a different flag out. So I do think that people are doing their best, but that comes with a risk. And so I think that people are trying to help, but it's a huge trust issue, where trust and fear that if I help people, I get arrested. So that's really the struggle. I think people would want to help each other more, but with the current circumstances, it's very difficult to help others right now. Although I think people are doing the best that they can, given the circumstances. But I mean, as the UN had pointed out this week, 50% of the population in 2 weeks could have it. How can you help each other in that situation if 1 in 2 people have it or have had it? I mean, it's very challenging. As someone who had to nurse someone while having it, I don't know how you could help other people. You're just trying to stay alive yourself.
Yeah, that's truly scary. In your case, so you were able to get all these supplies. Were you able to give them to somebody else that needed them?
Yeah, definitely. So, going back to the social media communication channels, people are always putting up, hey, can you help me with this? Or can you help me with that? And so once I was finished and I knew, okay, I probably won't need these antibiotics, I would offer them out to someone else, and then also, offered out extra test kits I had, because I realized that I could test positive for a very long time. So, just passed out the things that I didn't think I needed anymore. Because that's what you have to do. And then, even though we've recovered now, we're like, okay, how can we help people? But when you have it for 2 or 3 weeks, you don't have the energy to help others. you have to just focus on yourself. And I mean, I even cut social media out for weeks. I couldn't. It's too much. So I think once you get better, you're like, okay, how can I assist others? So we pass medicine on, we pass anything on that we think would be helpful for others.
Yeah. And do you think that a lot of people, are trying to share what they've got if they can?
Definitely. I think a lot of people are sharing, with their families or with their neighbors. I mean, even us, we're like, our oximeter is on loan if anyone needs it, in our building or in our neighborhood, because, that's what you have to do. People don't have access to everything that they need. So I do think that that's happening.
Great. Good. There was something else that you mentioned that I think is interesting, because I've seen some advertisements and campaigns coming out of other countries, maybe out of India, that address the stigma of COVID-19 and trying to combat this fear of telling people, or the fear of people who have tested positive. And you mentioned that you are not seeing this so much in Myanmar. Is that right?
Yes and no. I mean, I think that at this point, everyone knows someone who has died. I don't think anyone has been spared, sadly. I think everyone knows someone who's died, or most people have someone close to them that has it as well. And so I think that there's this idea of, solidarity now that, we are kind of in this together. However, of course, the fear still stands. I think that now with the current updates about it being as contagious as the chickenpox, I mean, there's a very understandable fear of others. When you see someone that's had it and you don't know if they're contagious and they're respecting that 14-day, I think that, people have a logical fear of wanting to just run away, especially if they're older. So I think there's like a logical fear now. But I also think that there's just not enough awareness of what Delta is doing to this country as well. So it's really hard to get rid of that stigma. I do think it's really important to tell people, but then also I think that there's just not enough knowledge that people can rely on right now, and that's credible, to really get rid of that fear either. But I do find a lot of solidarity. I think that people know that this is affecting everyone and no one can escape it. So I think yes and no.
There were people from the INGO community listening to this, and they were wondering what's the best way to reach Myanmar people in communities. Do you have any suggestions for them?
That's a great question.
So how to get information, especially information right now. How would you get helpful information?
I think be creative. Be creative and trust the local people. Of course, the international community maybe knows a lot about what's happening, but the situation in Myanmar is extremely unique, and I'm sure that they know that. But just consulting community organizations about what they think is best and then how to implement that, and just really giving a lot of trust to them that they know what to do. And I think that is the main thing I would always suggest, is just trust that the local people know, because this isn't their first struggle. And even though they maybe is their first pandemic, but it's still very much a struggle that is affecting the entire community. I think being creative as well, that, I think like one thing I noticed in the first wave was people would make posters and they would do this whole like pamphlet thing, but I thought it could be like a little bit more creative than that. I think they could really find ways to engage with the youth, engage with children, and engage with the community in a way that is more influential, I guess. I just feel like the efforts were great, but it doesn't have the impact sometimes to just make flyers and things like that. And so I think that's just one thing, is just collaborating with each region individually about what they think is the best approach, and just giving them supplies as much as you can. So I guess that's really my main suggestion to the INGO community.
So you were caring for your roommate, who got hit a little bit harder with the virus than you did. So were there ever times that you were planning for a worst case scenario, that if you would have had to take him to the hospital, but there's no hospitals?
Yeah. I mean,
what were you thinking you'd do? Because this is scary. This is the decision that a lot of people in Myanmar are having to make right now. So like, how do you think about this?
Well, I think also it's really different for different people as well. And so I think for me, it was like, okay, well, at what point do we send someone to the hospital? And that decision alone is extremely scary, because we don't know what the hospital is going to look like. We don't know what they'll do. And then you're sort of public, and then you're also exposed to what's happening around you, seeing dead bodies, which is what people were telling us we would experience. So it was very much like, if we went to the hospital, that would just be the worst experience. So why would we do that? But what if we had to? So I think that this is a really hard decision for people to make. But for me personally, it was never an option. Like I just was like the thing that I really didn't want to do, because all I kept hearing was, stay home. You can probably give the best treatment. If you can find oxygen, which luckily we were able to rent for an emergency situation. And in my eyes, I thought, we have the medicine, we have the oxygen, we have the oximeter, we have everything here. There's nothing else a doctor can do for us. And we're putting ourselves at a security risk if we go to the hospital. And then if we get to the hospital, we have to stay there for 2 more weeks. So it's just like this idea of like what that would be, how much that would cost. And it's just like all these questions are going in your brain. But biggest thing for going to the hospital was security. Why would I put myself in that situation? So I think that I mean, I guess security, maybe I wouldn't be at risk, but I just think it's just this idea. I don't know. It's just you don't know who's at risk, right? Yeah, you don't know. You don't know who's there. I don't know. There's so much unknown about that experience that it just was too scary. So I think maybe it wasn't a security risk. It was just more fear of like, what would that look like? Like, am I going to see lots of death? And that's scary in itself. So I think that sort of was the process. So I think we kind of, from my mindset, it was, no, I don't want to go there. So I'm going to prepare everything at home so that worst case scenario, we're here. And that everything is dealt with here. Whereas I think, for them, it was more like, I need to go. And it's like, no, hold on, So I would do calls to do like counseling calls, you're okay. Because I think people don't really talk about in Myanmar just how long it really it can last. And so you're just struggling for days and days, and you just feel like it's never going to end. And so it's really hard for people in that experience to make a logical
and
decision.
by the 5th day of being really sick, you're like, I'm over this.
Right, exactly.
Go somewhere.
Yeah. So I think like my list of, when would we do this was very different than my roommates. But at the same time, they had a fever and I didn't. So for me, it was like thinking of logistics, right? And thinking about, just being afraid of hospitals. Because I think I would just open my social media and it would just be something scary at a hospital. And I didn't want to go there. And the only options then were private hospitals, which would cost, I think some people are saying $10,000 to $20,000. And how would I pay for that? So I just financially and, logistically and looking at what I saw on social media, it was just too scary to consider.
What kind of bigger impacts has the COVID pandemic had on Myanmar society? We've talked a lot about kind of the individual experience, but what are you seeing on the society level?
I think the greatest impact I've seen COVID-19 have on society is on education. Schools have been closed for, over a year now. I mean, they reopened for a time this year, however, with very low attendance, even reported by the official numbers, it was very low. And I think that impact will be felt in society very soon. We're into the second year without schools, and even though some, private education services are happening, it's still not reaching the young people and the children. And I think that that's going to have a big impact on the future of this country. And so that's the biggest thing that we see. And also just thinking about that, in the West or in other countries, even Thailand, right? They opened and closed and opened and closed and had the option of online learning. So they're able to get information about, say, COVID-19 throughout this whole pandemic. But in Myanmar, you haven't had that option. From the beginning, the previous or the NLD-led government or civilian-led government had made a decision there would be no online learning. So there has really been no information sharing except for like the TV channel they made with the community about COVID-19. So I think there's some things maybe, through some forms of multimedia, but there's been not a lot of knowledge sharing about the pandemic. So there might be a lack of awareness about like what's happening in some areas. But then also, what is this doing to the children of this country? So that's been one of the biggest impacts. And then also just the idea of travel, right? You see a huge isolation. Parts of Myanmar were blocked off for many, many, many months. And so you start to see like this isolation from last year where these communities weren't allowed to travel between these communities very easily for months and months. And so you kind of see that effect on the economy as well. And, even before the coup happened, the economic crisis was very real and was very much experienced by millions of people. So I think that, the lack of transportation and also the impact on people's jobs has been huge. And so I think educationally and economically, there's been a massive impact on the community, even before the coup. So, I mean, the people started, in a really difficult position before this third wave even came about. And so so I think that that's the biggest impact that I've seen.
Yeah, a lot of impacts everywhere economically.
Yeah.
We saw a lot of those big hotels close down the middle of last year, even before anything.
Right, exactly. And even just the idea of migrant work as well, right? Economically on a local front, but also on an international front, they can't travel as easily. The Thai border has been shut for a long period of time. So it's been a huge impact, not only on domestic work, but people's ability to travel outside to find work. And also that stigma, right? I mean, there's been a lot of discrimination towards people from Myanmar in Thailand and in Malaysia, for bringing the virus to these areas. So they were blamed a lot at the beginning of this third wave for bringing, and also in the second wave as well.
From your perspective, are there any populations in Myanmar that are being especially impacted by this COVID wave?
So one that's made the news this past week has been the outbreak within prisons. So I think that is one of the most affected groups at this time. They're being denied, health supplies, and there's also, some big names of people that are thought to have had COVID, like Sean Turnell and Danny Fenster. And I think that we don't know a lot about it, but we do know, through leaked information that COVID is spread throughout all the prisons and that they're not getting the resources that they need. And I think that that's a big risk because already the conditions within the prison are very challenging. So I truly couldn't imagine, as someone who survived COVID, I couldn't imagine what it would be like to be in the prison during this time and worrying about this. So I think that population is being deeply affected by this. In addition, I think that IDP communities are also being really affected by this more than others because they are not able to access materials and resources and medical supplies like maybe other areas can because they might be on the run. And so, I think that that's one of the biggest challenges right now is like, how do you support those communities with medical care, especially if they're on the move? So I think that would be the two areas that are being deeply impacted by COVID-19 would be the prisons and the IDP communities.
Thank you so much for sharing that really personal, really emotional, really traumatic experience. with Insight Myanmar and the listeners, because we do get to read and we do get to hear on the news about the situation, but we rarely get to hear about this firsthand experience and what it really feels like to go through this kind of crisis. So thank you so much for sharing that with us.
Yeah, no problem. I mean, I hope that this is heard by many, because I do think that the world will be impacted by what's happening in Myanmar, especially regionally, but also, looking at what's happening in North America and other parts of the world, so I think that what's happening here is really relevant, and we're looking at a long-term situation where we need to work together and coordinate together and, support people, because if we don't take care of those who don't have privilege to get vaccines, we'll never get through this. And I think that that's the core message. We need to really support those who can't get vaccines, or else there is no solution in sight in my eyes.
After today's discussion, it should be clear to everyone just how dire the situation is in Myanmar. We are doing our best to shine a light on the ongoing crisis, and we thank you for taking the time to listen. If you found today's talk of value, please consider passing it along to friends in your network. And because our nonprofit is now in a position to transfer funds directly to the protest movement, please also consider letting others know that there is now a way to give that supports the most vulnerable, and to those who are especially impacted by this organized state terror. If you would like to join in our mission to support those in Myanmar who are resisting the military coup, we welcome your contribution in any form, currency, or transfer method. Every cent goes immediately and directly to funding those local communities who need it most. Donations go to support such causes as the Civil Disobedience Movement, CDM, families of deceased victims, and the purchasing of protective equipment and medical supplies. Or if you prefer, you can earmark your donation to go directly to the guest you just heard on today's show. In order to facilitate this donation work, we have registered a new nonprofit called Better Burma for this express purpose. Any donation you give on our Insight Myanmar website is now directed to this fund. Alternatively, you can visit our new Better Burma website, which is betterburma.org, and donate directly there. In either case, your donation goes to the same cause, and both websites accept credit cards. You can also give via PayPal by going to paypal.me/betterburma. Additionally, we can take donations through Patreon, Venmo, GoFundMe, and Cash App. Simply search Better Burma on each platform and you'll find our account. You can also visit either website for specific links to those respective accounts, or email us at info@betterburma.org. In all cases, that's Better Burma, one word, spelled BetterBurma. If you would like to give in another way, please contact us. Thank you so much for your kind consideration.
We're going to welcome Sandra Kong. Sandra, can you start just by telling us a little bit about yourself?
Sure. So I'm a Chinese-Burmese American, second-generation immigrant, meaning my parents immigrated from Myanmar after graduating from medical school. And I was born and raised in Texas, and growing up in a smaller town in North Texas, I didn't have much of a Burmese community around me. And so most of my exposure to Burmese culture was through my parents. And then a monastery that I traveled to a couple hours away from my home. And that is where I came to understand my identity and culture a little bit more, mostly through food and a little bit through religion, practicing Buddhism. And when the coup happened, through prior experience I've had in Myanmar through public health projects related to hepatitis and chronic diseases, I saw how the healthcare professionals on the ground were really leading this movement, but also in how long-term, if the coup was to continue and the military was to stay in power, how that would continue to strengthen would continue to harm the healthcare system in Myanmar that over the past few years has had so much progress in rebuilding, restructuring, and reforming its communities and connections with ethnic minority groups. And so over the past 6 months now, I've been leading global movement for Myanmar democracy with my co-founders Jen and Frank and our wonderful team in raising awareness in Myanmar and keeping the story alive, as well as addressing some of this cultural apathy that I once experienced with my own identity through the virtual space.
Yes, thank you. That's great. What can the Myanmar diaspora living in the U.S. do right now to help people in Myanmar that are living through the coup and now the COVID crisis?
Yeah, that's a great question. And I think the same actions at the beginning of the coup remain just as relevant now. And so whether you are Burmese or not, or whether you've even been to Myanmar, keeping the story alive, like I mentioned, is incredibly important, especially with so many events happening on mainstream media and on social media spaces. It's good among your own circles to keep updates coming along. And so there are a lot of Instagram accounts, Twitter accounts, Facebook pages that are very active in providing on-the-ground daily updates. And so on GMFound's website, we've listed a couple there. And through following those accounts, you'll see a lot more pop up. And so just staying informed and showing support for those who are affected by the coup. We think about directly addressing the needs of those on the ground. But also you do have people all across the world who have family, friends who are being affected and targeted. And so just checking in on them, showing support for their mental health and having a shoulder for them to lean on is incredibly important at this time. And within the US, there's actually a really important bill. So now calling the Burma bill, hopefully getting released within this month or the next month. And it's a very important piece of legislation that will strengthen tangible actions pitched from Congress to the executive department. And so this includes improved humanitarian aid, sanctioning a very large oil and gas enterprise known as the Myanmar Oil and Gas Enterprise. It's been one of the next big companies that U.S. lobbyists are targeting right now, as well as stronger accountability mechanisms, which is incredibly important as we eventually move to tribunals and justice mechanisms later on. So this bill is incredibly important, and what we've been doing in the past couple of weeks is just scheduling calls with our senators, and they've been very receptive, hearing stories of those in the international diaspora and friends of Myanmar and why this bill is so important. And so we need all of those voices as much as we can get so that this bill can finally be released, and showing our own representatives and senators that there is constituent support for this bill. And hopefully, through those who are listening, that they can get involved. There's a Facebook page called the U.S. Advocacy Coalition for Myanmar, and they're a group of activists very well trained in lobbying who are offering one-on-one support in reaching out to Congress. So definitely get involved there. And beyond that, there's a lot of fundraisers happening. The civil disobedience movement is what is keeping this movement alive. And so beyond that, support financially for these participants in the movement, there's a big wave of COVID-19 striking Myanmar right now. And so with the military shaking the healthcare system there, there's a lot of support needed for medical supplies, oxygen tanks, etc. And so also on GeoForm's page, we have a couple of fundraisers listed. And so they're really creative ways to also get involved in these fundraisers rather than just simply donating money. For example, there are monasteries and churches around the U.S. that are hosting food fundraisers on many weekends. There are stickle fundraisers going around. And so finding whatever creative means you have to help support the cause is also just as important.
Yeah, there's been a lot of activity and action lately on this. Yeah, that's right. I wanted to ask about what you know about what is happening to the healthcare workers in Myanmar at this time and over the last few months. What has their experience been like?
Yeah, so since the beginning of the coup, they, as I mentioned, have been leading the protests and boycott movements that are very much shaking the military in their control of the country. And so because of this, healthcare workers, doctors, nurses, even medical students who are at the front line of the protests are, one, being targeted by the military. And so in streets and in their homes being abducted in the middle of the night, captured, and many of them we haven't heard from since, or have since actually heard a confirmation of their passing. And for those who are healthcare professionals, we all abide by a code of ethics and commitment to our patients. And so with military control of many of these hospitals, these doctors are not even allowed to treat their patients. And when they do set up makeshift clinics, they also then targeted by the military physically. And so a lot of these professionals are running and hiding and living in fear. And as I mentioned also, the COVID-19 crisis in Myanmar is really exacerbating right now. And so doctors who are trying to treat patients, deliver oxygen, are also prevented and targeted through very horrific means. And even the patients themselves, there were a lot of reports of patients staying in line, waiting in line for oxygen tanks, oxygen pipelines that the military has cut off, and they're being shot at by the military. So this is just a few examples of how people's right to health is being blatantly attacked. And what we're seeing now is that, long term is really going to affect the long term health of the country and of the people. And so this is why we see this as not just a Myanmar crisis, but a global health crisis, especially in that with having the Delta variants in Myanmar run without any control, there is that risk of further transmission and more mutations of the virus.
That's right. And sorry to put you on the spot, but do you know what the current projections are for Myanmar? I know a week or so ago, they were as high as 50% of the population was expected to have COVID at some point. Do you know what it's at now?
Yeah, so I am hesitant to report projections as completely accurate just because there's a lot of factors that go into projections related to like environmental context, movement of people, reopenings of certain businesses. And we already are experiencing a severe underreporting of tests, confirmations, and deaths. But what I can say is that while I'm not sure how accurate the 50% is of infection, we are seeing an increasingly and exponentially growing number of infections in the country. And whatever numbers we see now, these are, like I said, underreportings. And so over the next few weeks, you will see a continued quick spread of the disease if you don't have the vaccination treatments delivered appropriately.
Your group, GM4MD, has some link to NUG at the moment, I think. You've been in touch with especially the youth representatives. What is NUG doing in this crisis, in the COVID crisis specifically, to help? What have they been able to accomplish?
Yeah, so we've been fortunate to listen on a couple of meetings. And so this was a couple of weeks ago, and so I'm sure a lot more has evolved since then. But the NUG was able to procure 6 million vaccines and form a COVID task force with ethnic health organizations across the country, and has started delivering based on reportings I was seeing on social media and media spaces. Which is incredibly exciting. And so through this COVID task force, hopefully this will improve vaccination distribution to a more equitable distribution, and especially among border areas, not only just in the main cities. And so that was a really really positive piece of news for vaccination development.
Yeah. Okay. That's really good to know. Have we heard anything about what the plans are for vaccination in general in Myanmar? I mean, so you did just mention that that NUG is distributing some. What about for getting further inland from the borders? Do we know if there's a plan?
So I hadn't heard from that last meeting. They were exploring a couple of mechanisms that are private just for security reasons, but they are working on them and working with the relevant stakeholders based on that conversation.
Right. And absolutely nothing from the military SAC as far as a plan.
I can't confirm that there's no plan from the military, but there's just difficulties with their administration of it and how that would be recognized in the military so far. So what I've heard mostly is from the NUG side rather than the military.
Right. Yeah. Yeah, it will be interesting. Even if there was a plan put in place, what would be some of the challenges in getting vaccinations to some parts of the population?
Yeah. One being outreach and being able to get throughout the country to deliver vaccinations. So this relates to problems even before the coup happened. And so while I was working in Myanmar for public health projects, one was related to hepatitis B. And so hepatitis B is a chronic, it's a virus that causes a chronic liver disease. And it affects a couple of years ago, like 6% of the population in Myanmar, quite large. Unfortunately, this disease is entirely preventable and could be eradicable if we are able to instate the proper prevention measures. And one way to prevent this is through a vaccination series that gives almost 100% immunity to patients. And this requires a vaccine. And so, not just in Myanmar, but around the world, you are seeing hesitancy among vaccinations due to a lot of false facts about vaccinations that have proliferated among communities. Maybe even then, among more rural areas, there is more of a presence of traditional medicine that leads to skepticism of more modern medicine treatments like vaccines. And so I know that while conducting some of those screenings and testings, there was a lot of education that was required, trust building with communities in order to deliver these vaccines. And so luckily there are infrastructures and communities in place that have been starting these conversations, but it is still a significant barrier in terms of once you get the vaccine and giving it to the people and helping them understand why it's so effective and important. And so, but within the task force, hopefully through their relationships with ethnic minority leaders, they're able to overcome that mistrust.
Yeah. Good. We've talked a bit about the oxygen shortage or long lines to get access to oxygen. What are some of the reasons there is such a shortage of these medical supplies and just basic medicines like ibuprofen? What is causing this?
Yeah, so one is lack of ability to procure supplies across borders. Sometimes a lot of medications, especially through nonprofits, are received through other countries. And so with the closing of borders, you're not able to receive these medications anymore in a safe manner. And so, of course, with the lack of supply and with high demand, that's where you're seeing that shortage of medical supplies. And so that's why it's so important to continue supporting these fundraisers who are trying to, through private means, get supplies and money through the country.
Good. Is there any truth to this idea that the military has been hoarding these things?
So we have heard of cases and reports where the military has prioritized their own comrades for treatments, for COVID treatment supplies and such. I can't myself completely confirm, but with regards to like COVID vaccines, for example, we definitely have seen these being administered to military folks versus prioritizing the international standards of age and chronic disease, which shows even more so how the health and rights of the citizens of Myanmar with the military in power will continue to be ignored.
So, do you still have family in Myanmar?
I do, yeah.
Yeah. So, how have you been dealing with the experience of watching this all happen from afar, from far away?
Yeah, I think one response was what can I do to help, which what inspired me to found JMD and more so seeing other people who had these similar sentiments of wanting to help, didn't know how to, providing them the platform to do so. And so it is really hard hearing these updates day by day that are progressively worsening, getting more severe. And so not only letting that drive and motivate me, but also letting that push me too hard of a balance with work and life. And so we're seeing that among a lot of people who are previously involved in a lot of advocacy, they've had to take a step back because of a lack of work-life balance from before. And so I think also leaning on what can give you peace and calm and reflection. And so for me, that is reflecting with friends, it's journaling, it's embracing, also positive parts of life like school starting and classes. And I think having that moving forward at the same time has been a good balance for me. And so checking in with the people I know on the ground as well, and hearing their stories, I think helps also ground me a little bit as well when I do often get stories from social media versus more of their personal takes on the situation on the ground.
Great. And do you feel a kind of solidarity with the health care professionals that are in Myanmar at the moment?
Yeah, as a rising medical student and seeing my fellow students with their strong passion for health continue to protest, it shows to me what it means to really commit to being a healthcare professional, what it means to be a doctor, what it means to at times having to put the safety of your patients first before your own. And that's something that was shown through COVID-19 across the world, but even more so now with doctors battling both this raging pandemic and also the raging military at the same time. So it's definitely led me to reflect on my own privilege of being able to pursue my passion for medicine without having to think about an oppressor tackling me and targeting me. Also really strengthened my drive to, in my interests in public health and in human rights, to continue pushing these themes forward in whatever work or departments that I get involved in.
That's nice. Do you hope to be able to go back to Myanmar and do some public health or health work in general?
Yeah, I have thought a lot about, what ways I can effectively and sustainably do global health projects within Myanmar. And so on the line, I would love to go back and continue engaging with the community partners that I was able to a couple of years ago. And so I always think there is a lot of talk about global health and the ethics of it, with a lot of people just parasailing in, a lot of volunteerism. And so I definitely want to see that change in Myanmar and having sustainable collaboration between partners here in the US and partners here in Myanmar. And I've seen how that's been really fruitful and hope to keep that collaboration alive in the future one day.
Yeah, that makes sense. That's good. Back to the politics a bit. Can you speak at all to the ASEAN reaction to the COVID crisis in Myanmar that's kind of spinning out of control and affecting its neighboring countries? What has ASEAN's response been? Has it been satisfactory? Yeah.
To be blunt, no. We, among a lot of ASEANers, don't have much faith in ASEAN. There's a lot of factors for that. One being they have a strong consensus rule. There's, very complex political dynamics between the member states. And so even within their own member states outside of Myanmar, we weren't seeing like a unified response among member states. And so it is disheartening to see a lack of solid action from ASEAN in supporting Myanmar in this time. This is why among advocacy spheres, we really are focused on pushing forward these other mechanisms. There's different NGOs and INGOs working to deliver vaccinations to Myanmar.
Yeah, it's been interesting. And this is a little bit off of the COVID-19 topic, but just because you're representing this youth movement, what do you make of the protests in Thailand at the moment? Do you think it's fair to say that they were inspired by what's been going on in Myanmar or related to it in any way?
I think just among the whole ASEAN region, you are seeing this threatening of democracy and human rights. Something I really learned a lot more about with meeting different human rights activists in the Filipino sphere and in Vietnam. So the protests that are happening right now in Thailand, they've actually been going on for quite some time now. And even when the coup first began in Myanmar around the same time, Thailand was experiencing protests too. And so I'm not sure if it's just inspiration for Myanmar, but more so like you're just seeing this tiredness from those in the countries of having to continue to face these oppressors again and again. And so this is where having and showing international support is so important so that they feel like the world is with them, is standing with them.
Right. They're all kind of in it together in a lot of ways. We're all in it together. Great. Something I was thinking about that you said was the there's like a lot of misinformation going around about what can cure or prevent COVID-19 in Myanmar. Do you have some examples? I know I was there at for the first wave of it, and I remember there was a very heavy focus on garlic and ginger. And if you ate lots and lots of garlic and ginger, you wouldn't catch it. What other kinds of misinformation are people getting?
Yeah, that's interesting. I haven't heard too much about misinformation in Myanmar alone, but I do know some misinformation people have about the vaccine itself is that one, because of the method of COVID vaccine delivery, some of them are mRNA, DNA based, meaning they do have mechanisms that can replicate your genes in the body, but it doesn't mean that it's changing your genetic information. It just means it's replicating the information so that it can create the necessary components of your virus fighting machines so that then it can create the necessary proteins and destroy the virus itself. There also were concerns about the effect of it with pregnant women as well. And so There have been research reports over the past couple of months that have shown how it won't, affect the baby itself. And then there's also, again, just overall mistrust of the vaccine itself, like I mentioned, and how it's been tested among certain populations. And so, at least within the vaccines in the US, that I believe some of them are getting delivered to Myanmar eventually. There has been efforts to ensure that a diversity of ethnic groups are represented in the clinical studies. Of course, it's not perfect, but it's not just like one-sided towards one ethnic group as well. And I think the last concern I've heard a lot is with how quickly the vaccine was rolled out. They think that it wasn't tested well. It wasn't really passing all of the security measures, but they were. It just means that a lot of the red tape and measures it take to that really slowed down the process of approving vaccines were amplified just to improve the speed at which the vaccine was approved.
Well, I thank you so much for sharing this. We touched on some of your medical expertise and some of the political arenas you're working in, and as well as your personal, the way it's affected you personally. So thank you so much for sharing all of that. And
yeah, thank you so much for having me on here.
We wish you the best of luck where everyone's really rooting for GM4MD to succeed and to be this power of youth, of especially Myanmar youth and Myanmar diaspora youth, and being the future of the movement. So good luck with that.
Thank you so much, Mary.
You've been listening to the Insight Myanmar podcast. We'd appreciate it very much if you could rate, review, and or share this podcast. Every little bit of feedback helps. You can also subscribe to the Insight Myanmar podcast on Apple Podcasts, Spotify, Stitcher, or wherever else you get your podcasts to make sure you don't miss any of our upcoming episodes. If you can't find our feed on your podcast player, please just let us know and we'll ensure it can be offered there in the future. Also, make sure to check out our website for a list of our complete episodes, including additional text, videos, and other information available at insightmyanmar.org. And I also invite you to take a look at our new nonprofit organization at betterburma.org. There was certainly a lot to talk about in this episode, and we'd like to encourage listeners to keep the discussion going. Make a post, request specific questions, and join in on discussions currently going on the Insight Myanmar podcast Facebook group. You're also most welcome to follow our Facebook, Instagram, and Twitter accounts by the same name. If you're not on social media, feel free to message us directly at info@insightmyanmar.org. Or if you'd like to start up a discussion group on another platform, let us know, and we can share that forum here. Finally, we're open to suggestions about guests or topics for future episodes. So if you have someone or something in mind, please do be in touch. We would like to take this time to thank everyone who made this podcast possible. Currently, our team consists of 2 sound engineers, Mike Bink and Martin Combs. There's of course Zach Hessler, content collaborator and part-time co-host. Ken Pransky helps with editing, and a special Mongolian volunteer who is asked to remain anonymous does our social media templates. In light of the ongoing crisis in Myanmar, a number of volunteers have stepped in to lend a hand as well, and so we'd like to take this time to appreciate their effort in our time of need. And we're always on the lookout for more volunteers during this critical time, so if you'd like to contribute, definitely let us know. We'd also like to thank everyone who has assisted us in arranging for the guests we've interviewed so far. And of course, we send a big thank you to the guests themselves for agreeing to come on and share such personal, powerful stories. Finally, we're immensely grateful for the donors who made this entire thing possible. We want to remind our listeners that the opinions expressed by our guests are their own and don't necessarily reflect the host or other podcast contributors. Please also note that as we are mainly a volunteer team, we do not have the capacity to fact-check our guest interviews. By virtue of being invited on our show, there's a trust that they will be truthful and not misrepresent themselves or others. If you have any concerns about the statements made on this or other shows, please contact us. This recording is the exclusive right of Insight Myanmar podcast and may not be used without the expressed written permission of the podcast owner, which includes video, audio, written transcripts, or excerpts of any episodes. Also not meant to be used for commercial purposes. On the other hand, we're very open to collaboration. So if you have a particular idea in mind for sharing any of our podcasts or podcast-related information, please feel free to contact us with your proposal. If you would like to support our mission, we welcome your contribution. During this time of crisis, all donations now go towards supporting the protest movement in Myanmar through our new nonprofit, Better Burma. You may give by searching Better Burma on PayPal, Venmo, Cash App, GoFundMe, and Patreon, as well as via credit card at betterburma.org/donation. You can also give right on our Insight Myanmar website, as all donations given there are directed towards the same fund. And with that, we're off to work on the next show, so see you next episode.